Thanks for keeping it on Great Day SA. We know that good nutrition and a consistent exercise routine are key to overall good health. In addition, preventative health checks such as screenings can help avoid more serious health problems by catching them early. Here's more from our sister station in Dallas.
It seems like every day we hear new health warnings related to diet and what we are consuming. But one thing that has remained consistent is that a good diet and a proper exercise routine can be very helpful with regards to preventive care for our bodies. But there's something else we should consider, and those include preventive checkups. Dr. Corey Smith with Blue Cross Blue Shield of Texas is here to tell us more. Good morning to you.
Good morning.
So having a good exercise plan, a consistent plan, and also with a good diet, those two components are so key in our overall health. But you say that these preventive health checks are also critical.
Yes, these preventive health checks are very crucial to detect conditions early. The earlier you can detect these conditions, the easier they are to treat and help you stave off certain maladies down the road.
All right, so let's talk about the difference between preventive health check and also a medical health check.
Sure. People tend to seek healthcare based on their needs. The treatment of an illness, injury, or infection is more medical care. People seek care because they're sick or injured. Preventative care, on the other hand, are the health care services like checkups, screenings to detect certain conditions, and vaccines to prevent certain illnesses.
So even though we might be feeling very healthy, you say that it's still important that we do these preventive health checks. Why so?
Definitely. These preventative checkups are definitely worth your time and effort. Catching a disease early can lead to better health outcomes. It can lead to a better chance for a treatment and a better chance for a cure.
What types of preventive exams should we consider?
Yeah, so there's many types of preventive exams that should be considered based on your risk factors. For a lot of people, it starts with the annual physical exam. And during this exam, your doctor may listen to your heart and lungs, do screenings for things like blood pressure and cholesterol levels, and they'll go over some vaccines that you may be due for to prevent illnesses. When the time comes, most doctors will recommend screenings for breast cancer, cervical cancer, prostate cancer, and colon cancer.
Let's talk about some of these exams. This has been top of mind. Last month was Prostate Cancer Awareness Month. This month is Breast Cancer Awareness Month.
Yes.
Tell me about the importance of those two screenings.
Yeah, those two screenings are very important. For women at average risk of breast cancer between the ages of 40 and 74, we recommend a screening mammogram every 2 years. Prostate cancer is unusual in men under the age of 45, but it's not impossible. Risk factors include age, family history, race, genetics. Men at high risk for prostate cancer or over age 50 should talk to their doctors about the risk and benefits of screening for prostate cancer.
And regardless, they should go on and just side on the air of caution.
Yes.
And consider getting those checks.
That's correct.
That's so important.
Very important.
All right, so also let's talk about how important the relationship is with your doctor. How key is that in your overall wellness?
It's very important. You don't want to wait until you're already sick to get to know your doctor. You want to find a primary care physician that you trust and schedule those annual exams that we're talking about. It's during these times, during those annual visits, that your doctor can help you plan ahead, set health goals, and make sure you meet those health goals along your health journey.
Anything else you'd like to add?
Yeah, if you don't have a doctor, do your research and make sure you find a doctor in your network. When shopping for a doctor, you want to ask if they take your health plan coverage and ask if they're accepting new patients, how long will it take for you to get an appointment, and if they have telehealth offerings. Blue Cross Blue Shield of Texas members can find a doctor in our network by going to our website, bcbstx.com, or via the mobile app, or they can call the number on their member ID to learn more details of the preventative services covered by their plan.
Thank you so much. We appreciate it.
Thank you.